All right, ASAP 2018 again. I am joined this time by Dr. Heil. Pleasure. Thanks for joining us.
Great to be here.
How's the show going so far?
It's been awesome.
Yeah?
Great talks, a lot of new information, and
Okay.
a lot of good education on techniques and technology.
Cool. Any favorite sessions that you've attended or favorite techniques you've learned?
Well, I mean, there's some really awesome panels on facial rejuvenation
Okay.
and body contouring, and we've been expanding our abilities and knowledge, and especially in the hair restoration realm.
Right. So are they talking about hair restoration here?
I don't think there's been a lot in the podium side of things.
Yeah.
But
Okay.
we've been progressing in that area in our own practice
Yeah.
over the last
So tell me about
couple
it.
decades. Well, it's come a long way. The image of hair restoration has been one, and for many years has been really bad. But then again, you can look at facelifts and bad facelifts over the years, and we've undone a lot of that
Sure.
that thinking about it.
Yeah.
So with the hair, we've totally moved into the realm of follicular unit extraction, and that basically is taking and moving good hair to bad hair areas the way God creates it on the back of the head, recreating that on the top and the front.
Sure.
And
Now this is...
the tools have changed that allow us to do that now.
Yeah, so typically it would have been like, you get that scar typically.
Yeah, the old strip method, which
Why
is...
did you get that?
Well,
Where did that come from?
I mean, that was developed over the years, trying to get smaller and smaller ways to move scalp, but
Okay.
you're moving scalp with hair in it.
Oh.
And the big change has been towards moving just a follicle unit, leaving the scalp behind, and selecting out just little individual follicles as a sampling, if you
Gotcha.
will, invisibly removing a small portion of the hair in the back that lives forever.
Gotcha.
And you use it to recreate what's thinned or disappeared on the top
Sure,
and the
sure.
front and the crown.
Okay.
And there's some major advances in the tools, and the most recent has been the evolution and advent of robotic technology as a surgical tool to do hair. There's only one in the world now that can do that.
Right.
And so we're pretty excited about that. It's now in our hands over the last couple months.
And what's that called?
It's called the ARTAS,
Okay.
ARTAS.
Okay.
And it's by Restoration Robotics.
Okay.
But they're basically infusing the robotic artificial intelligence ability to be a tool that helps a surgeon now move that hair in an automated robotic fashion, where every little extraction is consistent again and again and again. Speeds it up.
Faster. I was going to say faster.
It's like 3 or 4 times faster than what we can do in our human
By
hands.
hand. Totally.
And it gives you that consistency that the 2,000th follicle that's removed is the same as the first one.
Okay.
And you can do it 3 times faster.
Yeah.
And in the course of one day, a person can go from no hair on the front of their head and the top of their head to
That's incredible. It's incredible.
total change. They have hair again, and grows in over 3 to 6 to 9 months.
Is
just
it a multiple
depending.
treatment type thing, or depending on how much you need?
A lot of the time it's one and done.
Really?
Yeah, one and done. I mean, you can
Well, 'cause
do
you can do
regions.
so
You
much
can
at
do a
once.
back region as a secondary phase, or you can do a bigger case and kind of do it all at once.
Yeah.
It's
So
just
I've
different for each person's
I've also heard
needs.
you can use it on your face too, like facial hair.
Yeah, we do
Okay.
beards,
Yeah.
sometimes patchiness. I need
Yeah.
it myself.
I was
I
gonna
can't really
say.
do the beard like you,
Yeah.
because I got these little spots into
I'd
here.
still like
and
to fill it in here a little bit.
I've had other patients who want a little more of a straight,
Yeah,
contour.
sure.
I've had patients who it burns to their upper lip, and we've done small segments to replete what looks like a gap if you
Yeah.
try to grow that mustache or that beard.
Right.
So yeah, you can use it on facial hair reconstruction.
Cool.
You can use it in brow, eyebrow
Okay.
build up or reconstruction, or just
Yeah.
simply thin brows. Instead of taking tattoo and inking up your skin, you can put the actual hair in there.
Yeah.
They're off-label uses of it, but the tool's developed for one purpose. But if you can move a follicle, you can put it wherever you need that follicle.
Right. So this machine is actually, not only is it taking follicle out, it's also moving it and restoring it somewhere else, right?
Well, it's a tool that has expanded so exponentially that if I was talking about this 2 years ago,
Yeah.
I'd say, well, the robot can help you extract the follicles. Well, now it can extract the follicles. It allows you to be able to make the sites, little
Yeah.
tiny needle,
Mm-hmm.
you call them incisions, but they're little needle holes
Yeah.
that are made at the precise angle you want, the precise depth, with the 3-dimensional vision that the camera system can see.
So it's going
I
to show
can't see
you
down to 50 microns, but the camera can see down to the 50 microns on a digital level, and avoid the good hairs that are still there.
Yeah.
And place the new sites in between strategically to the density we prescribe. You lay it all out on the computer, and the computer system runs the robot to make all those sites. So now you can harvest the hair, you can make the sites, and they've just gotten FDA approval for being able to place the hairs into there. Otherwise, we manually place them in, and that's fine, and that's a smooth, quick process. But there's a prototype now that actually will be able to, as it makes the site, it's almost like a nail gun, if you will.
Yeah.
As the needle comes out, the follicle's already in there. You don't have to put it in there.
Beautiful.
So it's a little premature, but they have full FDA approval. It's just not in a commercial model yet, but that'll probably be, my guess is within a year, but I can't speak for the company. But we're just so excited that, I mean, all these changes are all in the last year and a half.
Cool.
Versus, you crawl, you start to run, you jog, and now it's like
sprinting,
Olympic sprint.
So you mentioned that there's not a lot of practices in the United States that even have this, right?
No, there's less than 200 in the world.
Oh wow!
And less than 100 in the United States.
Wow.
So
you're one of 100.
We're very excited. Yeah, we're one of about 100, and to be chosen to be able to bring that to Pittsburgh and Western Pennsylvania, and we treat like the whole tri-state area of Pennsylvania, Ohio, and West Virginia. And
you're basically the guy.
Those patients could read about this and go fly somewhere for it, but now they can come right to our region, be treated by someone there who's there 24/7, who's not a fly-by-night doc. And so we're happy to step up our game to that level.
Yeah.
But well within that new advent of follicular unit transplantation, which is a restoration that it's scarless. It's as, I don't like to use the word perfect, but it's as modeled to, God's hand of the beauty of our bodies, and part of that beauty is the slight imperfections and irregularities. But that should come from our choice to create that in a hairline.
Yeah.
Not because there's some imperfection of the harvest or imperfection of the tools.
Right.
So it's perfected the tools to the point where it's going beyond what we ourselves can do. Just like the robotic advents in general surgery, if I was going to have my adrenal gland or prostate or gallbladder taken out, I'd want my surgeon to be able to use the robot that can be used to do that, because that tool allows that surgeon to move beyond what he could do before.
Sure.
That's what we have in hair now. That's what's so exciting.
I love it. So you said that hair restoration right now comprises about 20 to 25% of your practice. Do you see that?
Yeah, it is. I mean, it's growing every day. What we find is it's a major issue for men, although we treat men and women, and this can be used in men and women. The FDA studies were in male pattern baldness, but women have hair loss issues, and it can be as big or even more horrifying an issue for a woman, because
of course they're not supposed to.
They're not supposed to. We can look distinguished and this and that, but they're all synonyms for you're looking old, you're looking more senior.
Exactly.
But it's a way that we've been able to build our male population, and that sounds more business-like, but when you look at it from the patient perspective, men get overlooked in the plastic surgery realm.
100%.
We have interests, and it's sort of like you walk in and they're all just focused on women's needs, and we want to be in our practice more balanced, that if we're dealing with male aesthetics and male needs as far as minimal downtime and quick recoveries, we want to be able to offer that to them in terms of hair, in terms of non-invasive fat reduction with cool sculpturing and ultra shape. We've been doing that for 7 years now too. And injectables in males don't want to bruise. Males don't want to look like they have some sort of alteration of their face. I don't think women do either. But men have avoided these topics because the stigma of think, well, I've seen other people that have that problem. I don't want to see that. I don't want to look like I was treated too.
Right.
And to be able to offer that to men is I think, fair and balanced.
Cool.
To be able to, time for the guys to be able to step up and, access our kind of care with the bent towards what the male needs are, and not forgetting about what the women need. And
I love it.
It's just really exciting.
Cool. Good stuff. Well, thanks for joining us. Appreciate you sharing the insight. Yeah.